This exercise is called transverse abdominis engagement. Now that's a fancy name, but the muscle, the exercise is named after the muscle that's contracting. Transverse abdominis is a really important muscle because it's part of a group of muscles that is integral for spinal pelvic stability. When people have back pain that's lingering for a long time, hip issues, pelvic pain, often this muscle is not properly engaging. Often you might be engaging other muscles of your abdomen. There's four muscles in the abdomen. We've got a left and a right hand side of the abdomen, and there's one of each muscle on each side. So we've got four layers. Often when we're trying to isolate that muscle, even if we think we've learned it in Pilates or something else, some sort of exercise program, we're pulling our tummy to our spine. Often, if there's some sort of pain or dysfunction, that muscle's not coming on properly. So this is really important. The muscle has a left and a right hand side, and the transverse abdominis is actually the deepest muscle of the abdomen. So that means if there's four muscle layers, it's the deepest, the fourth layer. The muscle connects to your ribs, the lower angle of your ribs, and to the pelvis, and it wraps around the body and it inserts into the side of the spine, the spinous processes of the spine, the transverse processes. And so these muscles have a horizontal orientation. Muscles contract along their muscle fibers. So when they contract, they're like two combs sliding together. If the muscle's horizontal, that means that when the muscle contracts, it actually has this action of pulling in and tightening towards your spine, like a corset contracting. We've got other muscles like the rectus abdominis, and that's like an ice cube tray. And when they contract, their fibers are lengthwise in little pockets, so our body will crunch up. The obliques have orientations where they're horizontal in different directions, and that will cause our body to twist. Often the best way to distinguish whether or not you're contracting the outer abdominal layers versus the transverse abdominis is if there's an outward movement of the abdomen when you contract. It's kind of hard to feel it sometimes, but if I put my fingers on my abdomen and I lift my head, I'll engage muscles and I'll feel this outward push of my abdomen. So I know I'm engaging the wrong muscles. When transverse abdominis engages, there's a feeling of a sheet that's hardening very deeply and pulling in. It's almost like if you imagine I've got saran wrap that I'm tightening, it's like flattening out and pulling in. And that's what you feel when transverse abdominis engages. Often it might be hard to feel it. So I'm going to show you first where to put your fingers, because you should use your fingers to feel it, and that will help. So if your hip bones are here and your belly button is here, I like to go halfway between those 2 points and keep your tummy relaxed, because if you're tightening your tummy, you're not going to feel very much. So your tummy's relaxed. My fingers are sinking towards the spine. And just to start, I'm going to do a Kegel, which is a pelvic floor contraction. So it's almost, I might pretend like I have to go to the washroom and I'm going to hold it. So I'm going to engage there. And what I feel is something hardening under my fingers, and that's transverse abdominis. I'm going to relax. So the transverse abdominis works with the pelvic muscles, which are the muscles responsible for holding your bowels and bladder. And so I want to train this muscle, transverse abdominis, to work without using the pelvic muscles. But the pelvic muscles can be really good to use to feel what transverse abdominis feels like with my fingers. And I'm feeling right now my abdomen contract when I do it. But now I want to be able to replicate that feeling without using my pelvic floor. So what I'm going to do is I'm going to breathe into my belly. And this, when I breathe in, it lengthens the muscle. And then I'm going to breathe all the way out, but just passively. I'm not contracting to force my air out. I'm just letting the air go in a relaxed way. At the end of the exhalation, that's when the muscle is short, in a shortened position. That's when I'm going to start 5%. It's the lightest contraction you can imagine. You almost do it in your head, imagining it before you do it. And you let the feeling of your fingers guide the movement. And I'm just trying to pull my fingers towards each other and towards my spine. Once I get that 5% contraction, I'm going to slowly increase it just until I feel the tensioning increase. And it's not really aggressive. It's not like 100%. It's pretty light. It's like 10 to 20%, but I feel this nice tension building under my fingers in the deepest level of my spine. And then I'm going to hold it for about 10 seconds, and then I'm going to release it. So an important thing about your position is that you make contact with the ground with your sacrum, which is the base of your spine right here, and with your lower ribs right here. There's a little gap, a little space for the curve of your back here. So you want to make sure when you contract, you don't flatten your back out. And you want to make sure that you also don't end up arching so that your ribs are lifting off the ground. You've just got a neutral arch in the spine, just a little gap there. So I'm going to show you again. You're going to breathe in. You breathe all the way out. And then at the end, just 5%. I'm going to start by pulling my fingers together and slowly intensifying. And when I'm tensing here, the breath has to move up into the lower ribs, the upper abdominal area. So I'm going to hold that for about 10 seconds. And then I'm going to let it go. And I want to repeat it about 10 times. This isn't a perfect recipe though. This muscle is made for endurance. It's made to work in all the other exercises I give you so that this is stable. So if that's easy, I would do more repetitions or hold for longer time.